Okay. I don't know if I should just start. I wonder if that background noise. Okay, good afternoon, everybody. We're going to begin our press briefing for COVID-19. I'm Peter Zanoni, Corpus Christi City Manager, and we have a little bit of a lineup this afternoon, and so we appreciate the community that's watching live on Facebook, as well as on YouTube, the City Channel, and our networks that are covering us today, as well as our local newspaper. We're going to talk about the COVID cases that we've had, the statistics, as we normally do. I'll present first on that. I'm also going to do a little bit of talking on nurses and this afternoon. We do have we have our major hospital chief executive officers here this afternoon, and they also are going to recognize nurses in our community. So that'll be second in our lineup this afternoon. Mayor Joe McComb is here, and he's going to speak to us as well this afternoon. And then we'll have a video and a live feed from Nueces County Judge Barbara Canales, and then our Public Health Director, Annette Rodriguez. And then our main attraction, though, is Dr. Bird from Texas A&M Corpus Christi, and he's going to be here to talk about modeling and what we can expect to see in the future when it comes to new cases, recovery rates, and so on. Okay, so that's our lineup for today. Well, let me just get right into it. So what I want to talk about first is the orders that have been put out in the last day or two, and bring to the community's attention that Governor Greg Abbott just issued 2 orders. They're on the city's website at this point, and I'm sure they're on the governor's website as well, but they're orders that address face masks as well as gatherings. And the judge will cover those in her comments later on in this briefing. The judge also, or the county and the judge, issued 2 orders as well in the last day or so. Those are on our website as well as the county's website. And then Mayor McComb issued 2 orders as well that mirror the county's orders for the beaches and parks and face masks, and those are all on the city's website. So I just want to bring that to the community's attention. Now, before I get into the numbers, yesterday we showed and talked about some of the outbreaks that are happening in the community. And we showed a map that had 9 assisted nursing home centers on a map, as well as a state assisted living center. And part of the conversation was that there were outbreaks at some of the facilities, and we want to point out that 4 of them were part of a targeted investigation by the health department to make sure there wasn't significant outbreaks. And 4 of those centers, though, only had, through the analysis this week, they only had 1 positive case. And so we're not considering those 4 centers to have a significant problem. And we want to point that out today. And so the Villa Assisted Living Center in the Northwest, the Elon Corpus Christi Nursing Center, the Vieira Assisted Living Center, and the Robstown Nursing and Rehab Center. While we went there to investigate and make sure there wasn't a significant issue, each of those 4 places just had 1 case of COVID-19. So we want the community to know. However, the other centers, the other 6, did have a more significant outbreak, and so those are still relevant. Okay, so let's look at the numbers for today, and we should have some visuals up here. So we know that as a community we've had some pretty significant numbers and new cases. Yesterday we had the highest ever of 362 new confirmed cases. Today our number's a little bit better, but still worrisome, 262 new cases for today. And what this does for Nueces County, and Dr. Bird will talk about this more, is it puts Nueces County, or makes us, the per capita, the county with the fastest growing number of cases on average per week or per day for metropolitan counties for the whole state of Texas, right? So that's not good news. So we have more cases per capita as a county than any other metropolitan county in the state of Texas. And you can see the evidence here. So 262 additional cases today. Let's look at what this means for active and recovered. We're still pretty consistent with yesterday. About 88% of all those cases are still active at 2,642. And then about 12% of all the cases, and this includes since the beginning of us counting, 12% or 367 persons have recovered. The number of persons in the hospital continues to increase, and today, at the snapshot in time when we did this, we had 185 persons in the hospital, and that's a significant number. You can recall back even before here was in the the 10s and 20s. But this places a tremendous burden on the system, the hospital system. 185 persons in the hospital as of today, which is an increase over yesterday when we had 170. And then when we look at persons that are in ICU, intensive care, that number today shows at a snapshot in time was 55. And that's a little bit down from yesterday's 58, but what we continue to caution the community when it comes to ICU and ventilators and that type of thing is that this number is a fluctuating number through the day. So at one point today, we had over 60 in ICU, but at the snapshot in time from the health district, it was at 55 at that point in time. So it wouldn't be... we have to take that with somewhat of a grain of salt that the number is less than yesterday. I think it's fair to say that things change in the hospital system, and at a snapshot in time was 55, but it could be higher even right now than that number. And then just a quick reminder on the number of deaths. We reported an additional unfortunate death yesterday of somebody in his 40s, but that did place us at 9 persons who have died in Nueces County because of COVID-19. And the point of this chart, for somebody seeing it for the first time, is that for the first 3 months as we tracked this, especially here, there were pretty stable, right, in the number of deaths. For the first 3 months, we only had 3 deaths in total. But for the past 2 weeks, we've had a total of 6 deaths, right? So that's how that graph is kind of read. So today we have 9 deaths in Nueces County. Okay, so those are the statistics. Now, we talked about hospitalizations and ICU, and you remember there are people recovering. And in large part, that is because we have a great nursing community in Corpus Christi, and that's the next thing we want to talk about. We want to take a moment to thank our nurses and their associated partners. We know the nurses don't do it alone, but we want to thank them. Those persons, those professionals are the ones that are in the deepest of trenches, right, when it comes to COVID-19. And they are closest to our residents when they do fall ill to COVID-19. And just on a personal note, I worry coming into City Hall each day, right, thinking, what am I going to do to stay safe and stay COVID-free? But it must be real difficult for a nurse going into a much more complicated environment every day. And so I personally, as the city manager, and I think we as a community want to thank the nurses for their profession, for their commitment to the profession, their bravery and their selflessness that they've demonstrated here locally and nationally through this pandemic. Just to put it into context, so we have a little bit of numbers to take away from here. So in Nueces County, we have 6,000 nurses. That's twice as many city employees we have. And the city organization has 32 different departments. It's also twice as many workers that are at CCAD. So at Corpus Christi Army Depot, there's over 3,000 persons that work in the helicopter fleet there for the country. So here in Nueces County, 6,000 nurses. That includes 4,000, a little over 4,000 RNs, registered nurses, 1,400 LVNs, licensed vocational nurses, and then about 450 advanced practice nurses. So 6,000 nurses. If everybody needed a nurse in Nueces County all at once, that would be 90 people for one nurse, just to put it into context, right? So one nurse is expected to help out 90 people if everybody in Nueces County needed a nurse all at the same time. And then in Texas, in the state of Texas, there's over 200,000 nurses in the whole state. And we are the second only to California in terms of number of nurses in our community as a profession. So that's some real good statistics, right, and a great profession. I did want to challenge our community that over these next several days as we celebrate the 4th of July and Independence, challenge the community to figure a way to thank our nurses, whether it's a Facebook post or if our neighbor down the street's a nurse or if our friend's a nurse. Let's find a way to thank them for what they generally do, but especially for what they've been doing through this pandemic. The city of Corpus Christi has arranged to thank them in a small way, and that is lighting our harbor bridge in white with some stripes of red in there. We're going to do that over a 3-night period around the 4th of July, so beginning Friday night, and then Saturday night and Sunday night. I'm sorry, Friday night, Sunday night, and Monday night, the 4th of July, Saturday. We'll have the bridge lit in white with white stripes to thank the nurses, just as a small token of our appreciation. The county judge, Barbara Canales, and Mayor McComb and I have invited 3 of our hospital leaders to join us today to extend their thanks so they can thank you a lot better than I can. Since they're leaders in the profession, we wanted them to come today to spend a few minutes with us to thank our nurses in our community. And first speaking will be Dr. Blow, Dr. Osbert Blow. He's the President and Chief Medical Officer of Christa Spawn Health System. Also Dr. Mary Dell Peterson, Chief Operating Officer and Executive Vice President of Driscoll Health System. She's here today as well. And then Dr. Eric Deppert, the Chief Medical Officer of Corpus Christi Medical Center that has the Bay Area and Doctors Regional Hospitals that we're familiar with. He's here as well. And so each of these individuals is going to come to this podium after we wipe it down and just spend a few minutes and to thank our nurses that work for them and then in general in the community. All right, so we'll do that, and then following the nurse recognition, we're going to have Mayor Joe McComb come up next. Thank you.
En resumen, las cifras más recientes indican que en las últimas 24 horas se han reportado 262 casos confirmados por el coronavirus, haciendo un total de 3.018 casos. 367 de los 3.018 se han recuperado por completo. 185 personas continúan en el hospital. 55 están en la unidad de cuidados intensivos. 2.642 continúan siendo casos activos. A la fecha se reportan 9 fallecimientos. En cuanto a las cifras, continuamos siendo el condado con el mayor número de casos positivos per cápita en el estado. Queremos agradecer a todo el personal médico que ha estado trabajando arduamente en los hospitales atendiendo a los pacientes. En el condado de Nueces contamos con 6,000 enfermeros, el doble de número de empleados que cuenta la ciudad. Quiero pedir a la comunidad que agradezca a un médico o un enfermero por el trabajo que han realizado durante esta pandemia. Para reconocer su trabajo, vamos a iluminar el puente Harbor de color blanco durante el día viernes, sábado y el próximo lunes.
Good afternoon, everyone. My name is Osbert Blow. I'm the President and Chief Medical Officer, as you heard. Thank you, City Manager Zanoni. Thank you, Mayor McComb. When I received the invitation this morning, I was very touched. And remotely, I'll thank Barbara Canales, since I know she's preparing hers, and Annette Rodriguez. Some of you and other venues have referred to this as us getting the band together. I feel like we've been on this long journey. And as I reflected what to say today, Being a trauma surgeon and having embarked on my medical career back in, dare I say, 1982, I have been thanking nurses for many decades. I would not be the physician I am today, a trauma surgeon who came here in 2006 and worked at Memorial, making level 3 to level 2. The commitment that the nurses have demonstrated throughout my entire career, the first responders, the essential partners. Really, when you think about healthcare, it really is a team sport. There are some key elements to that team, however, and the resilience and commitment of those team members are essential to making it operate. I'm reminded of one time I was on rounds and a resident very arrogantly looked at me and said, well, why are you taking that person's word over mine over what happened to that patient? I said, well, frankly, because that person's been with that patient for the last 14 hours. So she has the minute-to-minute information that is needed to help us make a difference in that person's care. I will say that COVID-19 has had a lot of negatives, but also a lot of positives. It's brought us together closer as a community. It has made us really come face to face with who we have to thank for our ability to exist on a day-to-day basis. And one of those very important people, groups of people that we have to thank, and maybe she was clairvoyant 150 years ago when Flora Nightingale said that the nurses won't really be the nurses that she envisioned for the next 150 years. But she was absolutely right. And the human race is dependent on them. So as heartfelt as I can express through a mask and a very wonderful career, thanks to the many nurses who have supported me, put up with me, and directed me, and everyone else, colleagues, essential partners, pre-hospital folks, the list goes on and on. I want to say on behalf of Krista Spahn that we thank you for your commitment. And I'll leave you with something I shared with our group. We get up every morning at 6:30, have rounds on the phone with about 125 people to get the day started. And when you hear how horrible the day was the day before, and then you hear that the staffing for the same day that you're starting has 0 call-outs, that is the definition of commitment. And I want to thank our nurses, and again, everyone at Krista Spahn for the privilege of being your President and Chief Medical Officer. And thank you for this opportunity, sir.
Siendo un cirujano del área de trauma, le quiero decir que yo no sería quien soy el día de hoy sin la ayuda y apoyo de todo el personal médico, especialmente los enfermeros, por su dedicación. El COVID-19 ha traído mucha negatividad, pero también cosas positivas, y eso es lo que nos ha acercado más. Quiero agradecerle y aprovechar esta oportunidad para agradecer a todo el personal médico a nombre del sistema Spahn.
Good afternoon. I'm Dr. Mary Dale Peterson, the Chief Operating Officer and Executive Vice President at Driscoll Children's Health System. And my background is as a pediatric anesthesiologist and pediatric intensive care doctor. And like Dr. Blow, and throughout my career, which is a number of years now, and I'm not going to give a date like Dr. Blow did, my prerogative there, but I really could never have done my job, nor can any hospital, nursing home, or many other healthcare facilities function without our nurses. They are our eyes and ears when we are not there. We depend on them day and night. They're there at midnight, they're there, at 4, whatever, they're there. And I think the COVID emergency that we have, been experiencing really, planning, preparing in March, April, and now, unfortunately, we're seeing a tremendous surge that really is not sustainable if you, the public, can't help us out. We are really grateful to all of our nurses who are working overtime, who, as Dr. Blow says, come to work every day, doing their job, acting as professionals. We couldn't do it without that. We couldn't do it without a lot of our nurses who may be in administration or other areas are coming back and helping on the floors, helping in our welcome center. Everybody is stepping up to do what's necessary to take care of our patients and the citizens that we serve. So from the bottom of my heart, I want to give a special thank you to all of our nurses. Thank you.
Yo tampoco podría funcionar como médico sin la ayuda de nuestros enfermeros. Ellos están ayudando las 24 horas. El COVID-19 ha sido toda una experiencia. Ahora estamos viendo un increíble aumento en los hospitales, pero ellos están ahí haciendo su trabajo y de manera profesional. Todos ellos han cuidado y atendido a los pacientes. Quiero aprovechar esta oportunidad para agradecer a todo nuestro personal médico.
Good afternoon, everyone. My name is Eric Debrett. I'm the Chief Medical Officer and Chief Patient Safety Officer for Corpus Christi Medical Center. And I have to agree with Mary Dale and Oz. What an honor it is to be in the ministry of healthcare. Some men and some women are called to be priests and mothers, sheikhs and rabbis, and others ministers to the sick. It's what we do every day. It's our ministry. I too started my career in internal medicine about 30 years ago, Oz. And humbly speaking, I think God gave me a gift. I could be a physician. But I learned many years ago that my patients got better not because of me, but because of a team. I'd spend 15 minutes, half an hour, maybe an hour at the bedside with a sick patient. And the nurse was there for 23 hours. Like Dr. Blow said, I believe the nurses, Oz. You're absolutely right. I believe the nurses. I could not be more proud of our nurses. We at HCA Healthcare have a mission statement, and it goes as follows. Above all else, we are committed to the care and improvement of human life. Our nurses don't just take care of patients. They take care of human life. They take care of each other. They take care of their colleagues. They take care of family members. All of our nurses do this. And it is humbling to see the commitment and the expertise that they deliver on a daily basis, despite the numbers that Peter shared with us. So from the bottom of my heart, thank you. One small thing we did today is we bought them some lunch. We'll do the same thing on Saturday. So today, lunch and also dinner, we'll do for the night shift. It's a small token of a thank you. I hope that they know how we really feel. Thank you.
Es un honor ser parte de la administración del personal médico. Yo empecé mi carrera en medicina interna. Lo que he aprendido en mi vida es que los pacientes no mejoran debido a mí, sino gracias a todo el personal médico. Yo estoy muy orgulloso de los enfermeros. Ellos han ayudado a todos, a sus colegas, a los pacientes. Ellos están comprometidos con todos. Desde el fondo de mi corazón quiero agradecerles.
Well, on behalf of the citizens of Corpus Christi, let me say thank you to Dr. Blow, Deppert, and Peterson for their leadership and their staffs at their hospitals. It's can't live without you, and we appreciate it. And there's not enough thank yous. Just please share with them that we have a great admiration and appreciation for all they're doing and what you're doing. Thank you very much. We're coming up on the 4th of July, and that means a lot of fun for a lot of people. We've had a little change of rules in terms of game plans because those of us in South Texas obviously like to go to the beach. But what we found is that the beach itself is not our challenge. It's the lure of the beach that gets folks here. And once the sun goes down after they've enjoyed a day at the beach, then they migrate into town and go refresh and reload for the next day. In other words, groceries and food or equipment. They go into the stores or restaurants, and that's really where the gatherings come in and the exposure to COVID have been taking place. And so we really just have to try to address how we solve that, and that's why the governor has made the orders that he's given and what we've done in order to try to protect people in the continued spread and explosion of this COVID. So the governor has issued his orders, and the judge has issued hers, which are a mimic of the governor. And then on a local basis, we've made a couple of changes additionally that would be, don't necessarily apply to the Gulf beaches, but to our bay beaches, and that is the McGee Beach and North Beach, or Corpus Christi Beach, whichever you may remember it or call it. The order that we signed today basically says that you can't have camping. Well, basically what we're trying to do is make it available for people to go out there if they want to walk, if they want to go swimming, they want to go fishing, that's fine, but we really, we don't want people gathering there, getting in groups, pitching a tent, doing whatever it is. And so the rules are that camping, sitting in a chair, lying down, sleeping, or eating really are banned so for the weekend. But the beaches are open for walking, running, biking, yoga, water sports, fishing, getting exercise, and that sort of thing. But we're trying to minimize the exposure and try to get control of the continued expansion of this COVID. Today was a encouraging sight in terms of the numbers were less today than they were yesterday, so that's good. And we hope that continues. But we've got to be vigilant in our efforts. And the governor's orders today, I think, is now mandating face masks to everyone when they're out in public. I've seen people wearing them while they're driving their cars. Well, I'll have to confess, I take mine off when I'm in the car. But when you're out in public, we do encourage you to do it. Some people question the wisdom of that. I've heard people that say it's the right thing to do, and I've heard people say it's the wrong thing to do. But as they say, for me and my family, I'm going to err on the side of caution and use the masks. I don't think it will hurt. And if it helps one person from being exposed and catching the COVID, then I think we've made a significant contribution. So I'm asking the community to join hands, and let's get through this together. Now, one of the things that we had to do as a result of this explosion in cases is that we postponed our 4th of July live fireworks celebration. But if you're like I am, you like to see fireworks on the 4th of July. So I have an alternative that I'd like to suggest to you, and you can do it from the comfort of your home. You can do it from the comfort of your patio if you take your television outside, or in your backyard, or wherever, and that is on our public television station, KEDT. Capital 4th will be the 244th birthday of our country, and they will be having a fireworks show in Washington, D.C., and I've seen them before, and they're fantastic. And I would encourage you to tune in at 7 o'clock, and I think they redo it at 8:30, so you'll be able to see the fireworks. And this year, it's a special tribute to first responders and essential workers in the coronavirus crisis. So everyone is recognizing the importance of the folks that are involved in ministering to the public and trying to get us past this. So enjoy those fireworks, since we're not going to have one here. And sometime later this year, after the coronavirus has hopefully flown the coop, we'll have us our fireworks. One of the other things I was impressed with, didn't realize, talking to the folks at KEDT, that They have been streaming these press conferences live on their radio channel ever since we started, and they have an audience, depending on the day, anywhere from 45,000 to 60,000 people listening. So our message is getting out as far as Victoria and other places. So they have a big reach, and if you're not able to watch them, you can listen on your way home. And so it's a wonderful thing, and I would encourage you to take advantage of this fireworks display on television until we can have it live and in color here in Corpus Christi. We do want to wish everyone a happy 4th of July, and we want you to stay safe. We want you to stay healthy, and we look forward to continuing to give you the information. I'm sure over the holidays we'll be making updates, even though we may not be having press conferences. I'm assuming that's a correct statement. And we want to keep informed as much as we can, and hopefully the numbers will begin to go down, and we'll start to kind of get a hold of this thing. We've had several big city mayor conversations, conference calls. Had one this morning, going to have another one tomorrow morning. And we've got issues in Corpus Christi, but I can tell you, after listening to the mayors from San Antonio and Austin and Dallas and Arlington, ours aren't the scale that they're dealing with. And you always try to find a little nugget of something to be positive about. Those folks have a major challenge on their hands, and they're running out of options. And so we need to continue to remember them as they're dealing with their issues, just like we're dealing here, and remember them in our prayers also, because their healthcare workers are as tired as ours are, and they've got a challenge that's bigger than ours. And so, but if we all hang together, we're going to be all right. And the good thing, I think, being the 4th of July, it does bring us to the realization that no matter what they say, that we live in the greatest country in the world, and I wouldn't trade it for any place else. And I'm proud to be an American, and I'm glad we're here, and I hope you have a wonderful 4th of July. Stay safe and stay healthy.
Yo también quiero agradecerle a toda la administración médica por su trabajo realizado hasta el momento. Ya está aquí el Día de la Independencia y la playa no es un problema, sino lo que conlleva el ir a la playa, como diferentes lugares y diferentes tiendas para poder pasar el día en la playa, por lo que el día de hoy se emitió una orden por parte de la alcaldía, la cual entra en vigor el viernes 3 de julio a las 6 de la mañana y vence el día martes 7 de julio a las 6 de la mañana. Esta nueva ley va a aplicar a las playas North Beach y McGee. La orden no permite acampar, no permite permanecer sentado en una silla, no permite estar acostado sobre la arena o durmiendo ni comer. Los visitantes pueden realizar actividades físicas que incluyen caminar, correr, hacer ciclismo, yoga, deportes acuáticos y la pesca. El día de hoy el gobernador emitió un mandato para usar cubrebocas en áreas públicas. Le pido que haga de su parte y las use para poder disminuir el creciente número de casos positivos. En cuanto a los juegos pirotécnicos, véalos por televisión, pase tiempo con su familia y ojalá pronto tengamos la oportunidad para tener juegos pirotécnicos en nuestra área. Le quiero desear un feliz 4 de julio, lo vamos a mantener informado lo mejor posible.
Okay, we're not through yet because we still have Dr. Bird, but we're trying to pull up a video from Nueces County Judge Barbara Canales. Is that coming up? It's coming on? Okay, so Nueces County Judge Barbara Canales will be up here on video. And then following her will be a live feed from Annette Rodriguez, Public Health Director.
Hello, everyone. Barbara Canales, Nueces County Judge. This afternoon, Governor Abbott issued an executive order requiring all Texans to wear a face covering over the nose and mouth in public spaces in counties with 20 or more positive COVID-19 cases, with very few exceptions. The governor also issued a proclamation giving mayors and county judges the ability to impose restrictions on some outdoor gatherings over 10 people, and making it mandatory that with certain exceptions, people cannot be in groups larger than 10 and must maintain 6 feet of social distancing from others. I will be issuing orders to reflect the governor's orders for Nueces County first thing in the morning. I am going to play for you the governor's video statement so that you could hear how he reached his decision.
Texans are resilient. We are tough and we are determined. We can accomplish anything we set our minds to. And that's exactly what we did in April when we slowed the spread of COVID-19. It's what we did in May when we opened back up, as we also lowered the positivity rate to just 4.5%, and we kept hospitalizations flat. But in the past few weeks, there has been a swift and a substantial spike in COVID-19 cases. So we need to refocus on slowing the spread. But this time, we want to do it without closing down Texas again. As I've said before, if the positivity rate or the hospitalization rate increase too much, we have ways to reduce the spread of COVID-19 without mandating stay-at-home policies. Both of those danger zones have now been triggered. First, I want to show a graph showing the daily number of people testing positive. As you can tell, in the last half of May, Texas averaged about 1,500 positive cases a day. This past week, that number quadrupled to more than 6,000 positive cases a day. Next is a graph showing the rise in the positivity rate. The positivity rate surged from 4.5% in late May to more than 14% today. Last is a graph showing the rise in hospitalizations. Hospitalizations for COVID-19 averaged less than 1,700 a day in the last part of May. This past week, that number tripled to more than 5,700 hospitalizations a day. Importantly, these spikes are not limited to just the big cities. More than 91 counties have hit record high numbers in just the past 3 days. Altogether, these numbers reveal a very stark reality. COVID-19 is not going away. In fact, it's getting worse. Now more than ever, action by everyone is needed until treatments are available for COVID-19. For example, hospitals in various regions of the state, they're being strained. Already reports from some regions show some ICU units nearing capacity. In short, we must do more to slow the spread without locking Texas back down. Now, there are several things that we can do that are proven to slow the spread. First, if you can, just stay at home. Also, if you can, try to work from home. Now, this is not a stay-at-home order. This just recognizes reality. If you don't go out, you are less likely to encounter someone who has COVID-19. If you do go out, stay 6 feet away from others that you are not traveling with. But of course, one of the best ways to keep businesses open while also slowing the spread is for everyone to wear a face covering like this when they go out. Medical studies have shown that wearing a face covering slows the spread of COVID-19 and it protects you and your family. That is why today I am issuing a face covering requirement for all counties with more than 20 COVID cases. This safe standard requires Texans to wear masks in public spaces with certain common sense exceptions. This requirement is not intended to be punitive. Instead, we just need everyone to do their part to help to slow the spread. That's why the first violation of this standard is just a warning. Subsequent violations are subject to a penalty not to exceed $250. But let me be clear. No one can ever be put in jail for violating this safe practice. Local law enforcement has the authority to enforce this safety standard just like they do when enforcing seatbelt standards. Now, I know that wearing a face covering is not the convenient thing to do, but I also know that wearing a face covering will help us to keep Texas open for business, and it will help Texans earn the paycheck they need. I also know that not taking action to slow the spread will cause COVID to spread even worse, risking people's lives and ultimately closing more businesses. Now, it's understandable that our early success, it may have led people to think that the coast was clear, that it would be okay to relax a little bit. Just a month ago, there were few COVID-19 cases, and hospital space was abundant. Just a month ago, many thought that young adults had no reason to fear COVID-19. But today, COVID is spreading like never before. And the virus, it doesn't know and it doesn't even care what your age, race, sex, political affiliation, or geographic location is. It will attack anyone, anywhere, and even do it without showing any symptoms. We are now at a point where the virus is spreading so fast, there is little margin for error. If we want to avoid lockdowns, if we want to protect those we care about, we need all Texans to join this effort. We have slowed the spread before. Working together, we will do it again.
Let me take this opportunity to underscore the governor's two key points. Wearing a face covering in public is proven to be one of the most effective ways we have to slow the spread of COVID-19. We have the ability to keep businesses open and move our economy forward so that Texans can continue to earn a paycheck, but it does require each of us to do our part to protect one another, and that means wearing a face covering in public spaces. Likewise, large gatherings are a clear contributor to the rise in COVID-19 cases. Restricting the size of group gatherings will slow the spread of the virus and keep Texans safe, especially here in Nueces County where our cases have skyrocketed. If we all commit to wearing face coverings in public spaces and follow the best health and safety practices, we can both slow the spread of COVID-19 and keep Texas open for business. I know a lot of people are talking about the beach order. And on this July 4th weekend, we want for you to celebrate our nation's independence. And many have said that any attempt to restrict access to the beach is an infringement upon their liberties. But our Open Beaches law also gives local officials the power to restrict access to the beach during public emergencies. We have and are in a public emergency. Restricting this vehicle access to the beach is a public health precaution. And I hope that it will deter people from going out to the beach because they will not be able to have access, vehicular access to the park roads leading to the beach. That's the whole point. The point is to reduce the spread and transmission of this virus. The men and women who founded this great country made great sacrifices, and we all cherish personal liberty. But persevering every personal liberty cannot put the public at risk. And this is why we have the power that the governor has given us to keep our community safe, to ask people and mandate in writing that we should wear masks. And that's why we have other types of powers when we need to for other emergencies, like closing schools. But the real power of our republic is that of us, the people, to understand that to secure our common well-being, our health, our livelihoods, and our lives, that we must obviously make some individual sacrifices. We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. These are our words. These are our words of our great nation and our government. And we were looking at the calendar, and on this very day in 1863, the Battle of Gettysburg was being fought. And later that year, President Abraham Lincoln would commemorate those lost soldiers with his Gettysburg Address. And he said in that address, the famed address, the great task remaining before us, that from those honored and these honored dead, we take increased devotion to that cause for which they gave the full measure of devotion, that we are highly resolved that these dead shall not have died in vain, that this nation under God shall have a new birth of freedom, and that government of the people, by the people, for the people shall not perish from the earth. Our government, by the people and for the people, is here to ensure the liberty of all Americans. That is a fundamental premise. But I know that the measures we have taken, protecting the health and safety of all the public here in Nueces County, may not be popular. Some feel that they're restrictive, some think they're not restrictive enough. I hear from all sides and respect all sides' opinions. But know this, what we are doing today, what the governor did today, is in our best interest. It is in the balancing act of our liberties and public health that will preserve the health of our economy. Our future freedom depends on our public health and our economic health. Today, I wish for all of you a very safe, emphasize safe, and happy Independence Day. Thank you.
En resumen, el gobernador Greg Abbott emitió hoy una orden ejecutiva que exige que todos los tejanos usen un cubrebocas que cubra la nariz y la boca en espacios públicos, en condados con 20 o más casos positivos del COVID-19, con pocas excepciones. El gobernador también emitió una proclamación que otorga a los alcaldes y jueces del condado la capacidad de imponer restricciones en algunas reuniones al aire libre de más de 10 personas y hace obligatorio que con ciertas excepciones las personas no puedan estar en grupos mayores de 10 y deben mantenerse 6 pies de distancia de los demás. El día de mañana la juez Canales va a emitir una orden que refleje la orden del gobernador. También dijo, le recuerdo que el haber restringido el acceso vehicular en las playas es para aminorar el número de personas en las mismas y evitar el aumento de contagios.
Good afternoon. Annette Rodriguez, Public Health Director. The Health District continues to focus our attention on our most vulnerable population. Statistics show that these are the ones that have the most fatalities, and they are the ones most likely to be hospitalized. Nueces County COVID-19 hospitalized patient continues to rise, and today we have a total of 184 COVID-19 patients. Unfortunately, these numbers will continue to increase until we can control the amount of people that are infected in our community. As we start the holiday weekend, I'd like to remind everyone that we are all blessed with free will. God has given us the ability to make decisions as we see fit. You can do what you want, when you want, as long as it doesn't harm others. No one takes offense at those decisions. But when you make decisions for yourself that it could affect others negatively, we must remind you that these decisions could cause our vulnerable populations to be hospitalized. So let me repeat some very important points. If you are sick, stay home. If you are positive for COVID-19, stay home. If you were exposed or what we call a contact to a positive COVID-19 person, stay home. If you are in the vulnerable population, stay home. If you just can, stay home. So with the holiday approaching us, I want to give you some examples where sometimes people fall short. So sometimes they go to the beach, individuals, and they're very good. They're very good at wearing a mask, and the family unit stays together, and they stay away from other groups. But sometimes they're just sitting there and they're enjoying the moment, and they see a couple of people that stand up and go start to smoke, and then they stand up and they go over there and they smoke with them. They honestly forget that these are individuals that they don't know, and they just start having a conversation. It's like they go back to how they normally do things, and so they make that mistake. And that's where sometimes you see people get COVID-19. The other instance is where you have a family unit, again, where they're very good and they wear their mask, they go to the beach, they social distance 15, 20 feet from any other family members, and they do really well. They spend the day there, they have a great time. But when the child needs to go to the bathroom, sometimes an older sibling will take that child to the bathroom. And when they do that, the parents don't realize it, but these children take off their mask and they start talking to other children that are in the bathroom, sometimes picking up the virus or spreading the disease. When people drink too much, we all know that good judgment goes right out the window. So don't be around others that aren't practicing good judgment. These individuals are what we call super spreaders, and they can get a large population sick in a very short period of time. People do really well at the work site from 8 to 5. They know personal protective equipment, they know to wear their mask, all of those things, they do it very well. But sometimes at lunchtime, they forget. They're going to lunch, they know they have to take off their mask. They take off their masks, they get with their other coworkers, they start enjoying the 1 hour, 30-minute lunch, and that's where sometimes we fall short. So, smoke breaks, lunch breaks, 15-minute allowed breaks, after work breaks or gatherings are many of the places we see our COVID-19 positive cases. Don't take a break from COVID-19. Your only break is in the safety of your own home. Everyone is susceptible to this virus, except of course for the few that have actually picked up the virus themselves. So it's up to you as to whether the behaviors that we practice this 4th of July are going to add to the intensity of the spread of this virus, or are we going to help in decreasing the spread? We make and take risks every day. We decide if we want to cross the street today. We decide if we want to drive in a car. We decide if we want to go fly on an airplane. These are all decisions that we make. These are also risks, and we determine how important taking these risks are to us and whether the risk is worth it for the desired outcome. While the 4th of July reminds us all of our independence, we must not forget the public health practices that are so simple and yet could save so many lives. These are washing your hands often. These are social distancing of at least 6 feet. 15, 20 feet is even better. Also wearing a mask whenever you leave your home. It's up to each of you to determine and to manage what amount of risk are you willing to take on this Day of Independence weekend. I also want to take a minute to say thank you to all of our nurses. This is amazing what they're doing right now. I have to say thank you to our infection control practitioners. I was an infection control practitioner myself for 10 years. And so I have to say thank you to those infection control practitioners that call us with every COVID-19 positive patient, that keep us informed of what's going on, how many people are in ICU, and they're working 24/7 to make sure that we are able to communicate this information to the community. So thank you to Phyllis, to Kim, to Nancy, to Gina, and all the other nurse practitioners, infection control practitioners. We appreciate you so much. I also want to say thank you to Dr. Blow, as well as Dr. Peterson and Dr. Deppert, and of course, our local health authority, Dr. Ram. You're saving lives every day, and we appreciate you because we know the hard work that you're doing right now, that you've done every day, but that you're doing right now. So stay well, stay social distance this weekend, and as always, stay informed. Thank you.
En resumen, nos seguimos enfocando en la población más vulnerable. Las cifras continúan aumentando. Le quiero recordar que las decisiones que usted tome van a tener consecuencias. Si está enfermo, quédese en casa, no exponga a los demás. Hay varias situaciones en donde se puede uno contagiar, como en la playa, en grupos, platicando o fumando, o en reuniones familiares, donde tal vez se le olvide, se quite el cubrebocas para ayudar a alguien y termine contagiando. Lo mismo puede suceder en su lugar de trabajo durante su hora de almuerzo, por ejemplo. Todos son susceptibles al virus. Su comportamiento va a aminorar o va a aumentar los contagios. Usted tiene la decisión. Yo también le quiero agradecer a todo el personal médico de nuestra área y al personal administrativo.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the TAMU-CC COVID-19 Modeling Task Force. We're starting about an hour later than normal today, and so I understand if a lot of you are tapped out after 60 minutes of this, and we do record this, and you can check it out later if you want to go get your dinner. But we'll try to touch upon things that weren't touched upon in the last 60 minutes and give you guys the latest on what's happening here in the Coastal Bend area. The objectives of the task force, for those of you that are new to our presentations, we address your concerns about COVID-19 and the interventions that are taking place. This is obviously a prescient time right now when new interventions are being implemented starting tomorrow, and we had new interventions implemented last week on Friday. The other purpose of the task force is to enable evidence-based decision-making. So we try to figure out as much as possible based upon the data available about what's happening with COVID-19 so that local leaders have the ammunition they need to know what to expect next. I believe we will take questions on Facebook Live, so if you have questions, feel free to post them. We'll address them, and like I said, if you can't make it through this presentation after the previous hour's worth of presentations, you can check it out later and see how we answered the questions online. So we're going to start with a slide that we normally start with here recently with what's an outbreak. It's simply a rapid rise in the occurrence of disease. It can be around the whole world, like what we're experiencing right now in a pandemic. It could be within a building, like we saw with some of the transitional housing facilities here in Corpus Christi in early May. So we're experiencing a Texas-wide outbreak right now. I don't know how much connection there is between Texas and other states, but we're not the only place in the United States that's experiencing this. And this is serious. This is different than anything that we in Texas have faced yet with COVID-19. I think it's important to remember how COVID-19 is transmitted. It's not just by touching things, it's also transmitted through the air. That's why you wear a face mask. It can be transferred from the air to somebody's eye, or somebody can breathe in COVID virus that exists in droplets that are expelled from your mouth when you're singing or speaking or talking or yelling. And so there's a variety of ways to catch it. This is what it looks like when on average one person infects 2 additional people through time. Each one of these time steps is about a week. The way the virus works, you can see it quickly spirals out of control. The rate of spread here right now, or at least a week ago, was even higher than this. It was about 3 people getting infected for every 1 person. So that's why you might be thinking, like, how did this happen? Well, this is exponential growth. It happens really quickly, and that's how we're in the situation that we're in now. Interventions that are happening, I wasn't aware of the new interventions before I made this slide, so this was as of 3 o'clock today. Stay at home if you can, social distance, and wear face coverings. It's really important. Self-isolate when symptomatic. Their schools are closed. I want to point out something. We're trying to get the virus under control. And during the stay at home, we didn't have one of the tools that we have in our toolbox now, which is the mask. This is the thing that's going to make that difference for us to hopefully not have to stay at home to control this outbreak. So think about that when you're making a decision of whether you want to wear a mask or not, this is the only tool that we have to decrease the transmission that we didn't before when we flattened the curve the first time. The thing is, the first time we acted much sooner. We didn't let it get to this point where it is now, where COVID is out there, and it's going to be hard to get this under control and bring the cases back down. So the other things that happened after these interventions were in place. We had Open Texas 1, Open Texas 2, Open Texas 3, and then last Friday, essentially Open Texas 3 was rolled back, and then today maybe a little bit of Open Texas 2 was rolled back. So we're in a 1 point to Open Texas 1.5 scenario or so right now. This report's for the 12-county coastal bend area. These are heat maps of the occurrence of COVID across all of Texas, and then in the coastal bend 12-county area, the brighter red, the more cases. You can see these numbers are getting pretty big. Right now, in total throughout this whole process from March to now, 2,394 cases in Nueces up through 2 days ago, because we didn't get today's data update before these slides had to be completed. And across the whole coastal bend area, there's a lot of people that are sick right now. So this graph shows the total number of cases in the 12-county coastal bend area through time, from early March all the way through about 2 days ago. 2,941 cases across the whole coastal bend, with 2,503 active cases. And just for context, here's that spike that we had back in mid-May. And now it's starting to almost look like a flat line. But I think everybody remembers in mid-May, we had a big spike up to all the way to 30 cases in 1 day. And then it came back down. And now look where we are. We had 362 cases just the other day, and a couple hundred cases, hundreds of cases day after day after day. This is very different than anything that we've experienced in the past. You can look at how steeply these lines are rising. That gives you an idea of how fast the cases are accumulating. So here we are in our Texas-wide outbreak. We can trace this back down to the beginning at May 22nd at about Open Texas Phase 2, or Memorial Day weekend. When that was put into place, from that point forward, we've been on this slow trajectory of increase at first, which has rapidly increased from then. This is the way exponential growth works. It doesn't look like a lot at first, then all of a sudden everything starts to skyrocket. 429 recoveries. The way these recoveries work is that after 14 days, if you're not hospitalized, you're considered recovered if you show up as a positive statistic. This is an algorithm that the state uses, and we fall in line with that. We use the same one. At the bottom, you see fatalities. Now, it looks like a flat line, but it's not. We went through weeks and weeks and weeks where this number of fatalities didn't change. Now it's changing every single time that I give a presentation. The number's bigger, and it's even bigger than 9 now, because I know that there was another fatality that wasn't counted for yet. So we're at least at 10 in all the coastal bend area. So here's something that we haven't talked about before, mainly because there was such a small proportion of the population that was infected that it wasn't worth talking about. But today it is. There's approximately 2 to 4% of the population right now represented by those 2,503 active cases that have COVID-19. Now, how do we get to 2 to 4% of the population? Well, in our own personal, not personal, but our local calculations, we estimate that there's about a factor of 5 difference between the number of reported positives from testing like this and the actual number of infections that are out there in the community. And the CDC, and I've seen several papers published that are estimating this rate, and they're all somewhere between 5 and 10x. So multiply 2,503 by 5 to 10, and that's where we get to 2 to 4% of the population. There's about 600,000 people in the coastal bend, and you're looking at 12,000 to 25,000 people infected in the Coastal Bend area right now with COVID-19. And that was actually a couple days ago. It's even higher now. This graph is a little bit different than the last one. The last one was the cumulative number of cases. This one is the number of cases each day. And each point on the graph represents the number of new cases that we observed in one day. You can see that we're hitting heights that are so high that back in some of the earlier dates, most of the earlier dates, you can barely even see it on this graph anymore because they're so low. There, that little hump there is the local outbreaks that we had back in mid-May. The circles are Nueces County, and the triangles are the rest of the Coastal Bend, the other 11 counties. You can see both in Nueces and in the rest of the Coastal Bend, we're seeing a marked increase in the number of cases, which I think everybody's well aware of at this point. Also, you can see on these graphs, I've marked off the different major interventions that have occurred, or the Open Texas phases. So Open Texas 1 started here. Open Texas Phase 2 started there, et cetera, as you move over. And then last Friday, we kind of rolled back Phase 3, and there was a mask order locally that was put into place for public places where you can't social distance. Now, these are all the counties in the Coastal Bend that aren't Nueces, that are not Nueces. So Jim Wells is increasing, San Patricio is increasing, Duval, Kleberg, Live Oak, Aransas, B, Refugio, and all these places we're seeing increases in the number of tests. Now with B County, you might say, well, it went up. How come it went up back here? There was an outbreak at a correctional facility in B County that was contained, and so that's the source of the early rise in B County. But you can see that it's on the rise again. If we zoom out a little bit to the South Texas region, you can see right here, Nueces has more new cases per day than any other county that we're looking at in this region. And I know these aren't county names, but not everybody knows the county names, so I figured the easiest way to deal with this was to put the city that everybody knows that's in that county. So Laredo, and Brownsville, and McAllen. And you can see San Antonio down here. You remember, we've been tracking San Antonio for months, and they were always above us, well above us. But that's not the case anymore. These numbers are per capita. So what that means is that San Antonio, there's more people than there are here in the Coastal Bend. So we scale at how many cases are we seeing per day per population size. And given that, that's where Nueces is rising higher than those other places. And Portland and Aransas are there at the bottom. So again, this is how the number of new cases per day is rising. We can zoom out a little bit more to all of Texas, and now we're comparing public health regions. This was a convenient way of dividing up the state. Again, we are using the most popular, one of the most popular cities in each of those regions to mark them, but you can see the color coding between the graph and the lines. And again, South Texas is the highest in terms of new cases per day per 100,000 people, which is a way to standardize for the different population sizes across these different areas. If you've been following this with us for the last couple months, you'll remember that it wasn't very long ago that we were at the bottom, and really up until very recently, and you can follow the curve, right there is when we stopped being at the bottom, when we started crossing the other lines. And now we've risen all the way to the top, and this is not a place that we want to be. We want to be at the bottom on this graph. Now, the fact that we're rising so fast in these graphs, it made me wonder, how did we compare to all the other metropolitan counties in the state? So this graph shows metropolitan areas. These could include multiple counties. So where it says Corpus Christi here at the top, this is us at over 40 new cases per day per capita. That includes Nueces County, San Patricio County, and Aransas County. And you can see that some of these different places will include multiple counties. Now this is every single metropolitan area in Texas. We here in Corpus Christi, Nueces, Portland, and Aransas together are number one in terms of the average number of new cases per day per capita. In this other graph, on the other side, what you can see is how fast are the number of cases speeding up or slowing down, accelerating or decelerating. So in the places where you see green, that means they're speeding up. So we're not at the top. Last Friday, we were at the top of this list. Now we're getting down closer to zero, which is good, but we're still on the positive side of zero, which means there's still some acceleration, some speeding up in the number of new cases that we're seeing. And the way that presents is that we have 362 cases one day and 200 and something the day before. That's what this is representing, that we're still seeing a rise in these number of cases each day. Now, luckily, we're moving down, but we want to get into the red. The red means slowing down. That would mean day after day, fewer and fewer cases. That's where we're trying to get to. And if we can get into the red over there in the change in new cases per day, then that can take us off of the perch here where we don't want to be and bring us down to where we used to be, which was way at the bottom of this chart. So switching gears, this is a graph that shows you how much testing is being done. And the orange shows you the average number of tests that have occurred over the last 7 days. And then the turquoise line shows you the average number of % positives over the last 7 days. First, I want to inform everybody that this is exactly the way the state of Texas calculates the % positives that they have reported on their DSHS website. So we have exactly the same algorithm. The difference is we're calculating it for the coastal bend instead of for any one county or for the whole state at the same time. The second thing that you need to know about it is that every single person that gets counted as a positive, they only get counted once. And the way that's happening is that in our public health department, positive tests come into the public health department, and they screen if there's multiple positives for one person. They ensure that only one person is counted, only one person can be counted in this number of how many cases that we're seeing. So for issues of double counting, that's not an issue for us here. We're doing our due diligence, and if there is 1 or 2 people that got double counted, it was an oversight as opposed to a pattern or a trend that's happening. We're explicitly, and when I say we, I mean the public health department is explicitly looking for this and filtering that out. Now, how is this percentage so high? It's 50% right now. And remember, I remind you that this is exactly the way that we're calculating. This is the way that the state of Texas calculates it on their website. And not all locations that do testing report negatives back. And so that's one of the ways that we get to this 50%. And so what this number that we're looking at tells us is where are we at compared to some other point in time. Back here in late May, early June, this number was calculated exactly the same way, and we were at 1%. Now, today, this number is calculated exactly the same way, and we're at 50% of all of the tests that are being recorded. There's a positive person. Now, I know everybody out there wants to know what proportion of people are actually positive that are getting tested. And the best answer we have from that comes from the testing that's done by the public health department here. And on average, about 30% of the people are testing positive. Now, for that testing and only that testing, we know how many people tested negative. We know how many people tested positive. Nobody's getting double counted on either side. And that number is about 30%. So hopefully that addresses a lot of the questions that people have about this graph and where we're getting these numbers from. And in the end, the important part of this graph that I find, and realize we only started doing this in late April. And the reason why was because I didn't trust this data before late April. I knew that it wasn't representative. But since that point in time, up to present, there's been about the same number of problems with the data, meaning that it's comparable across these different time periods. And so we're still going up is the take home of this. All right, we look at cell phone data to be able to identify changes in foot traffic, people leaving home, potential encounters, in order to determine what's going to happen next. It takes about 10 days before we do something to change the transmission rate of COVID-19, and we would start actually seeing that in the case data. So we don't want to wait that long. We want to see what's happening now. We know in the cases, everybody can see the cases are published every day. It's going up. It's going up every day on average. But is our behavior changing? And so I always show this image from The Dark Knight, because in 2008, it was extremely controversial to track everybody's cell phone. But today, we all willingly do this when we download an app and we check, yes, I'll let this app have access to my GPS. If you're being tracked, it's because you opted into it. The data that we see doesn't have anybody's names or addresses on it. It's anonymized, and it's probably one of the few times this data is going to be used to not sell you something. But generally, this data is out there and available to sell you things and to target you for advertisements. We're going to use it to figure out how well we're responding to the present public health emergency that's in place. So this is a graph that shows the average distance traveled for people in the coastal bend area and the number of people that are leaving home. And it's turned into a standardized metric where 100 means normal. So before the pandemic started, there was a certain amount of cell phone activity in these metrics, and we decided to standardize it to 100 means 100% of normal in February and early March, before we really realized that COVID-19 was here. So that's what 100 means. You can see that when we flattened the curve the first time and we didn't get into this situation that we're in now, we massively decreased in the amount of distance traveled, the amount of people leaving home was much less. And then from about Easter forward, Easter's right here at these dips, moving forward, we've had this steady increase until about the last week or 2 weeks. We started to see a change in people's behavior. And these lines fit through the points. They're smooth. The points are there to show you this is a daily estimate, day by day by day, of activity from either distance traveled per person or the proportion of people that are leaving home. And we can see there's a lot of noise in it, so we fit this smoother through it to show general trends. And I think it's very encouraging to see downward trends in these metrics. Now, just because you travel long distance doesn't mean you're going to contract COVID-19 or spread COVID-19, but it might mean that you're going to a lot more places than you normally would. So that's why that metric is interesting, and leaving home is pretty obvious. And here's each of the vertical lines again. This will be a consistent trend through all the graphs. These are the different interventions that have been taken, and whether it's putting them in place or rolling them back. In terms of number of encounters, this metric is looking at 2 cell phones, and then when they come within 50 feet of each other, or 50 meters of each other, then an algorithm is triggered. How long do they stay next to each other? And it's calculated the probability that those people will come in close enough contact to transmit COVID-19. And we've broken this up into weekends, which are defined as Friday and Saturday. We didn't include Sunday because some Sundays, it's like a Saturday. Some Sundays, it's even less activity than a Monday through Thursday. So we just removed Sundays. We're looking at Monday through Thursday for weekdays, Friday and Saturday for weekends. And for the first time over the weekend, we've had really numbers that are well below 100% for the first time since Open Texas Phase 2 approximately. So that's a good sign. So that was last weekend, and what that means is that people are responding to the emergency that we're in right now, and they're decreasing the amount of encounters that they have. And I believe that you heard the governor say, and maybe some of the other people that were up here say, that the more people you come in contact with, the higher probability is that you either transmit or contract COVID-19. That's why we like to see this metric right now going down, because we need to decrease those numbers of encounters if we want to get this under control. Last one of these I'm going to show you is the essential gatherings in blue, which is right now we're using grocery stores and home improvement stores as essential locations where people gather and are in one location, and then malls, restaurants, bars, and movies, which are not in blue, that are locations that are not essential. And you can see for the non-essential locations, the amount of visitation and foot traffic at bars, malls, and restaurants was increasing, but there's been a response now, and that we are responding and bending downwards in activity. Some of you might be wondering with the bars, how is it still so high? Well, the cell phone data lags a little bit. So June 29th, that's not today, it was a few days ago, and it's taking some time for that foot traffic to bend down. I've read some articles out there of bar owners who have avowed that they're going to stay open. If you're a patron of bars like I am, now's not the time to go to a bar, especially because they're not supposed to be open, and it's important for stopping the spread of COVID-19, and it's important for other owners of businesses that are allowed to be open to follow the rules to ensure that we're decreasing the transmission rate. It's not good for business, COVID-19. Right? So we want to do things that don't promote the spread of COVID-19 to protect business and to help our economy thrive and move forward. All right, moving on to our estimation of the transmission rate. It's stayed about the same since last week. It's at about 3.1. Now, it's probably a little lower now, and the reason why we're still estimating 3.1 is that it takes about 10 days, it could even take longer, between when we start to take action and when we start to see changes in the numbers of new cases and a metric like that. It takes 5 days on average between when you get infected with COVID-19 and when you start experiencing the symptoms. And then after that, it could take several more days before you get tested and receive the result of that test. So that's why we're saying on average 10 days, but the more people that need tests and the harder it is to get testing, the longer and longer it takes to even see if we're having an effect or not. So what this 3.1 means is that one person on average infects an additional 3.1 people. So after 1 week, 3 people are infected from 1. After 2 weeks, 10 people infected from 3. After 3 weeks, 30 people infected from those 10. And then after 4 weeks, 92 infected from those 30, which leads to 136 people infected in 1 month from one person that's positive. I want to remind you that there was about 2,500 active cases of COVID-19 right now in the Coastal Bend area. So imagine if we started with 2,500 people in this first position and go out a month without changing this number. That's why we're doing what we're doing, because what that leads to is something that we can't allow to happen. It'd be an absolute unmitigated disaster. It's not wild speculation. We watched this happen in New York City on TV, and maybe you knew people that lived in New York City or somewhere around that area like I did. It really happened. That was something that really happened, and that's the danger that we're in now, is that type of scenario can happen here in Texas and potentially even here in the Coastal Bend. And that's what we don't want to happen. So with this estimate of the transmission rate and knowing what could potentially happen in terms of our effectiveness of interventions, what we're focusing on right now is the ICU and how many people are in the ICU. This graph with the red points, it shows the number of people that were in the ICU on each day in the Coastal Bend. From day to day, in each point, a person could be counted on one day and also on another day. So it's not just new people in the ICU, it's how many people were in the ICU on that day. The line and the ribbon are estimating the same thing. Those are generated by the model. Now in this model, what we do is right up till here, we have the transmission rate be 3.1. And then right here on this day, last Friday, we changed the transmission rate to 0.5. And this is what I consider to be the most optimistic possible scenario that we're facing, where we're able to reduce the transmission rate from Thursday to Friday last week as much as we did at the peak of the stay-at-home, where we decreased to a transmission rate of about 0.5. And what that means is that on average, it took 2 people with COVID to infect 1 additional person with COVID. So obviously you'd see a decline. So we see this as the most optimistic scenario. And with that scenario taking action last Friday, you can see that it takes a few weeks, 2.5 weeks before the peak is hit. And that's assuming that last Friday we went from a transmission rate of 3.1 to 0.5. Now, based upon the cell phone data, it doesn't look like we were able to do that. But like I said earlier, we have one more tool in our arsenal now that we didn't have during the stay-at-home, and that's these masks and face coverings that we're all wearing. They can decrease the transmission rate by up to 50%. Now that's optimistic. Not everybody's going to wear a mask, right? We all know we see people out in public that aren't wearing masks, so every person that doesn't wear a mask, it decreases the effectiveness of masks overall. You can see here, to get down to 0.5, we need an 84% reduction. So we need masks. We need other things too. That's why you see these additional interventions taking place, limiting gatherings to 10 people and shutting down places of business where we think that transmission was probably pretty high. And this is what we see as the best case scenario. Now, a silver lining or a glimmer of hope here is that you'll notice that our projection is a little bit above what we're seeing right now. And what we can hope for is that because the projection's a little bit above, maybe our peak won't be so high as this is indicating. However, this is a very optimistic projection. This is still an optimistic projection, but not as optimistic. Right now, what we did in this one was transmission rate of 3.1 right till last Friday. And then from that point forward, we decreased the transmission rate by 68%, which is a lot, more than just masks can do. That gets our transmission rate down to 1 instead of being 3.1. And 1 is better than 3.1, but it's not good enough for where we need to get to. Because what getting to a transmission rate of 1 means is that every person that gets COVID gets one more person sick with COVID. And what that leads to is we stay where we are now at hundreds of new cases per day. And I think we can all agree that that's not where we want to be in terms of how many cases of COVID that we're seeing. This leads to more people in the hospital, more people in the ICU, and it leads to more fatalities. Like we've seen this uptick in fatalities as the number of cases have risen. And there's a delay. You're not going to see the fatalities kick in immediately or even hospitalizations. It takes a little bit of time between when you realize you're symptomatic and when you go to the hospital. And God forbid, if you have a really bad response to COVID-19, it takes a little bit more time before you end up in the ICU or even worse, not making it and surviving COVID-19. So there's going to be delays. So we have a huge amount of new cases per day, and we're going to be seeing the effects of that for a while, as you can see here, where just decreasing the transmission rate to 1, it delays when we hit the peak and the number of people projected to need the ICU in the coastal bend area. And so the lower we decrease the transmission rate, the more we wear masks, the more we social distance, the faster these numbers will come down, the more lives that will be saved, and the quicker we can go back to something closer to normal than what's happening right now. I'm going to leave you with these last two slides. At least I'm going to leave you on the data front. We showed these two slides for the first time, or these two graphs for the first time last week. And all we did is this is the most simple modeling that we could do. We took the number of cumulative cases that we've seen since Open Texas Phase 2 started, which was Memorial Day weekend, and we just fit a simple exponential curve to the data. And what you can see is that the exponential curve fits extremely well. And what that means is that the number of new cases is increasing as if nothing was being done to stop the spread of COVID-19. And when we see the points start to break away underneath the line is when we know that we've been able to break that trend. But right now, up through the most latest data we haven't been able to break that trend yet. And even there, the points are actually higher than the line. When I run this for all the other counties in Texas, Most of the counties that deviate from the fit, the exponential fit, they go below. And that's where we want to be. But we're tracking above. Last week when I showed this graph, and it ended on the same day, which is Sunday. Now we're projecting for just 4 days from today, which is Sunday. If you don't remember, that went to 3,250 new cases since May 22nd. Now you can see, because we've been falling above the line, that it goes above 4,000 new cases by Sunday. Now, that's if the testing doesn't max out and there's not limitations on the number of people that test positive, because there's just not enough capacity in the system to be able to process people fast enough and get the test done. And we could very well see that we won't hit that number. Now, the reason why I'm projecting to Sunday is because that's 10 days from last Friday when we first implemented orders to do something. And just to remind you, we expect it to take about 10 days before we see any effect of the actions we take on the number of new cases. Okay, last slide. It's just like the last one, except it's just number of new cases per day instead of cumulative cases. So, and I'll remind you that the 362 from yesterday is not included in this because the state didn't update their website before I had to finish the slides. But you can see again, is there's a very nice fit of the data of the model to the data, and we're projected by Sunday on this trend we're on, if the testing capacity can keep up, to have 500 new cases approximately. And then from that point forward, hopefully things that we've started to do can decrease those numbers. Now, we may never see 500 because it might not be possible to do enough tests to see 500 people test positive in that period of time. So in summary, there's a Texas-wide outbreak of COVID-19 right now. I think most people are aware of this at this point. COVID-19 is still expanding in South Texas. It's still accelerating in South Texas. It's not slowing down yet. 1 in every 25 to 50 Coastal Bend residents have COVID-19 right now. We are estimating that based upon the idea that there's between 5 and 10 more people that have COVID-19 than our testing actually indicates. These numbers are backed up by scientific studies, and they're backed up by our own estimations and simulation of the pandemic here in the Coastal Bend area. So what this means is that when you go to the store, if there's 25 to 50 people in the store, there's going to be, on average, at least one person in there that actually has COVID-19. So don't chance it with your mask. You need the mask almost every place that you're going in public. We have up to 8 more days until changes made last Friday affect cases. Hopefully it's Sunday, but it could take 2 weeks. And the longer delays there are in the testing pipeline, the longer it takes for us to see, are there changes happening? Are we doing enough? Do we need to do more? What I will say is that it's fairly likely that we're not going to come down as rapidly as we went up. And in order to go down as rapidly as possible, we need to social distance and wear masks. We need to do everything we can right now to get this transmission rate under control. The hospitals are experiencing a surge. I describe it like a rising tide right now of more and more patients in the hospital have COVID-19, more and more people in the ICU have COVID-19. And as you saw earlier, people at the hospitals are working overtime to help to treat all of us and keep us safe and healthy. It's important for everybody to try to help contain the outbreak. This slide is mainly for people that own businesses and managers and people like that. We recommend you do as much as possible to stop the transmission of COVID-19. COVID-19 is bad for business. Crushing the curve, good for business. So no shirt, no mask, no service. People wear shoes, I'm okay. If they don't wear shoes, I'm okay with that right now. You want to wear a shirt? Really, I'm okay with that right now. Wear a mask. Second, it's really important to close loopholes in the social distancing policies that you have in place. Obviously, in the state of Texas, that's what we're trying to do right now. We're trying to close loopholes to COVID-19 in our society because it found them and exposed them and showed them to us very plainly. And if you don't find them, COVID's going to find it. And there's no shame in people contracting COVID. Most people that contract COVID, it's not because they did anything wrong. And that's one of the things that maybe is the most concerning about it, is that you'll hear a lot of stories of, everybody, a lot of people did things right. I don't know where I got it. There's no shame in getting COVID. What there is a concern about is if you hide that you have COVID and continue to go around about your life. It's important that you contact your medical professional. If you're sick, it's important to self-quarantine and make sure that you're not passing it on. And so wearing face coverings can reduce transmission by up to 50%. Social distancing, as Public Health Director Rodriguez said, at least 6 feet, but she was saying up to 20 feet away, right? So listen to the Public Health Director, self-isolate. Here's something I don't talk about too much. When you're washing your hands, I read a study about 6 months ago that if you don't dry your hands, you're much more likely to pick up a virus off of a surface than if you dry your hands. So don't just wash your hands, and we're all washing our hands very often. Dry them thoroughly before you leave the bathroom or wherever you are that you're washing them, so you don't increase your chances of picking up COVID from a surface. Postpone social gatherings. It's definitely not the time. You should patronize your local restaurants and businesses in a safe way. Curbside, takeout when you can. If you can't, wear a mask. I think that's really important. And it's important to support testing and contact tracing, but at this point, there's so many cases it's hard to contact trace across the community, and we're doing the best that we can. So there's a lot of people that help to make these presentations happen every week that are analyzing data. We're working behind the scenes trying to make new analyses and generate new figures to help the public and also public health officials and things like that get a hold of what's happening with COVID. So I'd just like to thank everybody that's working really hard on our team. And with that, I think we'll have a translation.
En resumen, las intervenciones no farmacéuticas continúan sugiriéndose. Ahora se suma el uso de los cubrebocas para aminorar el aumento de casos por el virus. Actualmente, el área de la costa cuenta con 2.941 casos por el virus. 2.503 son casos activos, o sea que no se han recuperado. Se estima que del 2 al 4% de la población en el área de la costa está infectado con el coronavirus. El condado de Nueces es el condado del área sur de Texas que cuenta con el mayor número de casos nuevos per cápita por el virus. En promedio, un 30% de las personas que toman la prueba del COVID-19 resultan positivas. Esto basado solamente en los resultados del Distrito de Salud Pública. El radio de transmisión continúa siendo de 3.1, o sea que una persona contagiada va a infectar a 3 más. En un mes se traduce a 136 personas. El uso de cubrebocas está probado que aminora el contagio del virus hasta en un 55%. Se estima que una persona de cada 25 a 50 cuenta con el coronavirus en el área de la costa. En alrededor de una semana se verán los resultados de las medidas tomadas hace una semana. Se le recuerda utilizar el cubrebocas cada vez que esté en público.
So I think we're going to take some questions from Facebook. Often the questions are ones that I can't answer, so we may need Manager Zanoni to also help out.
Yeah, there'll be a couple of questions, and like I said earlier, I'm with the task force, and we vet through some of these questions. Some of them get answered online, but the ones that we may need everybody to hear from Dr. Bird or Mr. Zanoni, we go ahead and ask them live. So first question is, and this may be for you, Peter, are we expanding the testing capacities?
We're expanding it to the extent we have supplies, materials to take the test. So there was a drive-through test today. It was one of the questions on Facebook, and we had about less than 200 people that we had planned to run through there. Less than that showed up, a little bit over 100 showed up. But that limited number was called because of testing supplies. We're still waiting on some of the supplies from the state. So you can see in some of the charts that we showed this week, the number of tests have gone up this week. But by doing that, we're running through our supply. So there's a balance of need. There's over 2,000 people that need a test, and then the materials that we have to administer them. So we're constantly trying to get more supplies from the state, and we can only test as many people as we have supplies to test. So that's the answer to that.
Thank you.
And I can add something to that. I run a molecular lab at Texas A&M Corpus Christi, and I think anybody that has a supply chain would admit that if they had a sudden 100 times rise in the demand for certain products, that they would find a hard time to meet that. And so it's not just here in the coastal bend, it's the whole state. And it's not just the whole state. There's a lot of other states that are having huge spikes in COVID-19 also. So the demand for the supplies is skyrocketing. Planning wasn't likely planning for 100 times more than were needed on average up until the beginning of June. And so this is my own way of rationalizing this and determining that we're expecting. Last Friday I said that I expect that maybe the testing won't keep up because of that huge increase in the amount of tests that would be needed.
Okay. And Dr. Bird, how many weeks are you thinking is required to show the spread?
To slow, okay, yeah. How many weeks? Yeah, I was just thinking about. I was like, right now. How many weeks would it take to slow the spread? Okay, I think this is a very straightforward answer. We could slow the spread in as few as 10 days. At least we could see that we were slowing the spread that fast. Now, that being said, we can look at other places that had big problems with COVID-19, like New York City. It took them 40 days to hit the peak. It's possible to hit the peak after about 10 days, but it took them 40 days to do that because they had to keep ratcheting up social distancing and various measures to decrease the transmission rate. So hopefully we've learned from those previous situations and we'll be able to slow it down faster. That being said, getting it to plateau and peak may take longer than that amount of time. The first time we'd expect to really see that occurring potentially is Sunday. And then from that point forward, if we don't see the peak, then we didn't do enough to decrease the transmission rate. And we want to keep trying to ratchet that up. I would surmise that that's why today there's new measures being put into place by the governor, is that after 7 days, or 6 days, they didn't see an effect. And it would be possible, if testing was being done really, really fast, to see an effect of our change in behavior after 6 days. But really, it's going to take 10 days, 2 weeks. And I expect we will see a bend, but I don't know yet if that peak is going to be reached that quickly. It's just a matter of how fast can we get the transmission rate below 1.
And I apologize for the muffling of the mask. Why are we tracking up like higher than San Antonio, Austin, Houston? And is this really just a human behavior?
First of all, we're tracking higher because of the per capita nature of the way we're comparing. So there's probably, I'll admit that I haven't looked at how many cases there actually are in San Antonio and Austin recently, but I'm looking at how many cases per 100,000 people are there, and we're certainly higher than them in that respect. The reason why we're higher than them is that the transmission rate here in the coastal bend area was faster, and it didn't just stay at one number. I know we present one number, but it was accelerating, indicating that the number was constantly getting higher and higher. Beyond that, I think would be, at this point, speculation to know why exactly here we were the highest, and we accelerated the fastest, as you saw last week, and we've reached the highest rate per capita. And if you look at that graph and rewind, it's not even close between us and the second county. So There's a lot of factors that go into it, but basically we were doing things to increase the transmission rate. That's the best explanation I can give.
And again, this week, the people on Facebook thank both of y'all for the work that y'all are doing and the time that you're putting into this. Thank you.
All right, thank you very much.
Okay, we're a little bit past our normal time, but is there any questions from the media? Okay, you guys want to go celebrate the 4th? Okay, good. Well, thank you all. That concludes our presentation for today. We will not be here in the press briefing environment until Monday, but staff is working tomorrow and over the weekend, critical staff in the health department, our communications department, myself and others will be working. So we'll be updating our website with information, including number of new cases. We'll be back here Monday at 5 o'clock, and we'll be here every day next week for press briefings. So we'll see you all then. Thank you.